Okay, I'm excited to turn things over to Bob.
All right, everybody, thanks for having me. So a little bit about the mission for today is going to talk about in more of the state bids, requirements, things that are expected of MCOs. It's how are you interoperating with social services, right? As SDOH and social care come to the forefront, more and more behavioral health is carved in. How do you work with criminal justice, law enforcement? As evidence and data show, can an MCO be the connective tissue in the state? And by doing that, we'll be well positioned to both be retained and to win state bids. That's sort of the focus of today. To just show you, what I'm going to do is show you a few outcomes we've been able to produce, and state officials we've been able to get to rally behind programs that have this interagency collaboration. So this is just a 2-minute video from 2 different states where we have that, and then I'll go on.
Every 25 minutes in the United States, a baby is born with neonatal abstinence syndrome, NAS. Women with opioid use disorder are more likely to be low income, more likely to receive inadequate prenatal care, and more likely to suffer from depression, anxiety, hypertension, HIV infection, and more.
Too many of these folks are mothers or prenatal mothers who are about to have a child that may be at risk for neonatal abstinence syndrome. And it's clear that we need to bring new ideas, new technologies, a different way of thinking behind this epidemic. It is a crisis that we can no longer wait to address. And bringing innovative solutions to bear will be absolutely necessary for us to finally be able to get ahead of this.
Well, a very warm welcome to everybody here to Billings and for the GoMo Health Recovery Pathway National Launch. I'm very grateful to have been able to see firsthand the work these organizations do to reduce drug abuse and drug-related crime in our communities and support the health and the well-being of Montanans and their families. Recovery Pathways delivers a virtual interactive platform to provide Montanans with resources and additional support as they return to a new and a much healthier daily lifestyle.
I'm thrilled to see the innovation and success that will come from this partnership with Substance Abuse Connect and GoMo Health. Too many Montanans are suffering from addiction and substance abuse disorders, and we've got to ensure our treatment programs like this one have the tools they need to treat them. That's why I've been a supporter of Medicaid expansion. The science tells us that there is no one-size-fits-all solution to substance abuse disorders, and that's what makes the new Recovery Pathways program so special.
I'm trying to, sorry about this, I'm just trying to advance. Okay, so let me tell you what's going to happen today. A little bit about me. My focus is in behavioral cognitive science. My specialty is community building and developing and fostering resiliency in vulnerable populations around the world. Those engagement programs are used in many countries around the world. In the US, our programs are used by over a dozen Medicaid plans and over 15 or so health plans overall. To give you a little bit idea, just to share some of this, to know where this presentation is coming from an evidence-based perspective. Last year, we did 21 million encounters of members in the US. We had close to 250,000 escalations where we detected early warning signs of an adverse event, saved approximately $250 million for our clients, have a high retention rate, which you'll understand in a second, and we deal with thousands of case managers and care coordinators. Now, assisting me in the presentation are 4 experts. 2 of them are from Medicaid plans, Lavini and Nikisha, and 2 are from social service community organizations who plans need to figure out how to work better with. So it's very interesting to hear from Venus and Kristen some of the data and perspectives of those that plans will need to align with from a social care integrative programmatic perspective. So, like I said, the focus of today is, can an MCO position itself as sort of the connective tissue to accomplish these types of new state requirements? Okay, how do we collect Z codes, and how do we address social determinants? Because if we don't, they're not going to pay attention to their health. How do we integrate community-based organizations in a more practical way? Okay, hey, with the shortage of staff and growing number of needs, can we credential and have a better way to integrate family caregivers into a care coordination protocol, right? And then how do you win specialty populations and those things? So, and of course, maternal child health. So we're going to go through the methodology for today is all on this connective tissue. We are going to show you 4 real life examples of how we're doing that. And then in the end, we're going to bring it together on how we do this for a Medicaid plan. Prior to that, just to give this talk a little credibility, we're going to share a couple more outcomes to show you that this approach works in the real world with evidence-based, measurable plan data outcomes, and also go a little bit into our methodology of how we do it. How do we work with care coordinators, case management? How do we work with a plan and the members from a methodology and approach perspective? So just to do a couple slides on different outcomes. So our program in the state of Nebraska got actually a day named after it in 2017, Pelican Day, because we saved, it ended up hundreds of women from harming themselves and the baby, because we detected early that their depressive and other symptoms may lead to that. And for the Heritage Health, the Medicaid plan for the state, we really reduced costs in maternal child health significantly. So if you can do that by doing this, working with various state organizations from a plan and health perspective, you can hit some outcomes. So I'm not going to read these outcomes, but we do maternal child health in dozens of states, both prenatal, postpartum. In fact, over 80% of the HEDIS measures in maternal child health actually started month 7 and over. In integrative physical behavioral health, we do a bunch of those things. And I just picked 2 chronic conditions to show you. And again, this presentation will be available, so I'm quickly going. Interestingly, a lot of these programs are designed to close gaps and meet and exceed HEDIS, STAR, and NCQA quality measures and other measures that are necessary amongst the providers in a value-based care situation. So just wanted to show you some of those outcomes to show that by having a collaborative approach and integrating other community and social service organizations and caregivers into a program, you can produce significant results that will get you bipartisan support within a state. And the way we do it, it's not the purpose of today, but just to give you a little glimpse into that, is we have an engagement program and a managed service that helps your care coordinators, case managers, pop health, community teams, as well as the members themselves, directly engaging the members in a highly behavioral and cognitive way. And to give you a little color, in my area of science that I focus on, the stress today for everybody, for your workers in every position and your members, patients, is extremely high. And it's just too much cognitive overload for people. So I'm not going to go into the deep cognitive science here, but you can see on the screen, these are what, when people are faced with too much, they shrink and you get less productivity. It's tough on people. It's tough to hire, tough to retain. And members who are experiencing stress are not going to focus deeply on their physical condition, whether it be diabetes, cardiovascular, COPD, or even focus on their behavioral condition. So what can you do to mitigate that, to modify a lifestyle and behavior? So what we do is we have an evidence-based science that's used with over 10 million lives around the world. And what we integrate is psychosocial support into our engagement protocols. And that would include things like social determinants of health, but it really understands how to listen and learn in terms of a digital engagement, machine learning, and also how we present and help the information to your care coordinators and case managers to make them more productive. And I'm going to show you that exactly the results of that in a second. But to let you know, from a pure science-based, this is what having a behavioral approach, and I don't mean it in behavioral health, I mean in a behavior modification lifestyle approach to dealing with your team and members. Here's what we've been able to accomplish. And when you accomplish these things, you change outlook. That outlook helps form new routines, schedules, that forms habits, that causes neuroplasticity in the brain to change, and the habits affect better lifestyle. So there's definitely clear ways of doing this. And let me just show you an impact. So this is a report from one of our Medicaid plans, a rather large one. It just took a slice of it, but when they put GoMo, added it to the telephonic caseload of case managers, they had a 500%, it was like, I think their number to us was 547% increase in caseload, while the joy and practice of the case managers was increasing. They could actually take a lunch break, those things, because GoMo's doing a lot of that perfunctory work. We're not going to get into all the details of how we do that. And I just want to show you the 1 + 1 is 3, and we're communicating to the members. So by helping the case managers and helping the members, you can really scale the population reach, which is what a state's looking for. You know, not outreaching to 100 people, outreaching to 100,000 people. But to give you an idea, you can see we reduced in half people referred into the GoMo program versus not. In this slice was half, and we have their hospital inpatient report, which is about half as well. So I just want you to know these things have measurable results. To give you a little insight from a person who was at a couple Medicaid plans, working with providers and the plans on quality performance, is Nikisha. So she'll give you, this is about 3 minutes. She'll give you a little color of her life and what she found.
So that would be part of my territory. So helping to manage those provider networks with their care gaps. So I would disseminate the care gaps to these different healthcare provider networks, and let them know what was compliant and what was non-compliant. So you have a broad range of measures. Okay, so whether they are compliant with diabetes or blood pressure or immunizations or any preventative care screenings, I would take this to the provider network and I would go over their reporting with them. I would go over their value-based contract with them to ensure that they are closing the gaps in care. Okay, so what happened in my experience was that larger provider network would then trickle down those reports to each individual clinic. Throughout my career, what I realized is that doesn't work. That doesn't work. Those people put blinders on because they do not have the capacity to do the work. I activate those population health nurses or coaches or case management team to then in turn reach out to those members to close those gaps, which is the health plan's goal, right? So it became very manual. There is a very distinct way to create this activation and member engagement so that the health plan could actually realize their return on investment, right? Their initiatives, aligning those processes. So it wasn't about just going out and say, close these care gaps. We needed to start looking at gaps in process. There was not just, here's your report, is how do I empower them and activate them to scale what they needed to do? They may call 100 members, right, through the course of the week, but they've got a report of 10,000 members, right? They have a 10,000 member report just from me, not to include other payers, right? How do I activate that? We activate that by customizing and individualizing care plans for each member. That's the difference of 100 people being called that week, 50 people scheduling, 25 show up, 10 have social determinants of health factors. We can scale that. You may have engagement for 10,000, 5,000 show up. We've addressed 10,000 social determinants of health issues, and we may have 4,000 members show up. That's the scalability and activation we are able to create. That is what we were missing while I was sitting at my desk, overwhelmed and tasked with how do I get them to get these members in, to close these gaps, increase the HEDIS stars and CAP scores for my health plan. So that would be part of my territory. So
Sorry, hold it 1 second.
To manage the.
Okay, so now we're going to get into some real examples. But the idea of this, if you're listening and you're at an MCO, how do you be the glue to do this? And actually, there's some simple ways to do this that we've done in many states around the country. And we're going to show you those examples on how you can be the glue and accomplish that. So this is a program that is around OUD, SUD, and for general adult population, and also specialty program for prenatal, postpartum women. There's actually specialized tracks and messaging for Indigenous Native Americans, and it slightly alters if you're live on a reservation or you live off the reservation. And you could see all the organizations that are participating and that we could get data from and ping and interoperate, which can help the plan really collect the information it needs. But there's FQHCs, there's the whole justice system, the police, and a lot of different community organizations. And let me just show you the results of this interagency program, and then Kristen will give you a little bit of a slice of her perspective of it. So these are some of the measured results. 6 times improvement in someone's living environment, 2020 to 2021, 12% improvement in self-esteem, 10% relapse rate versus national average of 40 to 60, no rearrests, because some of these people were discharged prison population as well. Here's a great stat, 48%, 50% improvement in employment. So we got it up to 74%. Part of the program helps people with how to interview and dress and talk. And when you get these things, improvement in self-esteem, living environment, employment, all the medical data improves automatically, right? It just improves automatically. If you're employed, you're less likely to relapse, get arrested. You're more likely to get a better relationship with your children, your spouse, and do things that make sense. This is interesting from a plan perspective. We improved 72% in the ability to complete medical record status. And we had 90% completion of this entire program for people with the national average is around 50 to 70%. So, so the idea is by having a multi-agency approach helps. Kristen, this is a little under 3 minutes. She'll give you her perspective from a public sector perspective of how
Kristen
things work.
Lundgren. I have been working at the intersection of health and social determinants of health for over 20 years in Montana, in a rural frontier state, working very hard on solving complex problems in our community that require the healthcare sector as well as the public sector, the nonprofit sector, problems like addiction, crime, and poverty. And currently, I head up a coalition of about 80 organizations that includes all those multiple stakeholders, county, city, healthcare, education, to really drive down addiction and addiction-related crime in our community. So that's me. That's what I do. And the reason that I got connected to GoMo was because of really the intractable health problems we face in our community, where status quo isn't working. And, you know, you have your traditional clinical settings, your public health, you've got everybody doing a good job on their own in their own silo, but collectively we're not moving the needle on health in our community. So we created this recovery pathway program where everyone that's involved in our drug courts is signed up through their treatment provider. And we have a treatment provider that runs 7 different drug courts, so many different drug courts. And we created a solution that's customized for each one of those drug courts. It follows exactly the program follows exactly where the client is at. The content of the program was developed with the counselors in the programs, the judges, as well as the folks in court themselves. We can pay attention to cultural factors, tribal, rural, frontier, those kind of things that matter for us in our state, we can pay attention to. And so, they sign up. We've had over 500 folks enrolled at this point. And the thing, again, that everyone loves about this program, again, the judges in the courts, the treatment provider, the fact that we're preventing relapse and rearrest through this. Again, I would say we've had over 500 escalations. We've been doing it about a year. So I would say we've prevented over 1 relapse a day. And the last thing, I guess, that it does that I think is important is there's a module for a family member or a support person. So a lot of times we know what makes the difference in health outcomes is how much support do you have and the people around you. So that ability for someone in drug court to sign up a loved one who is their support person, and that person gets messaging that helps them be a better support to the person in recovery. Kristen Lundgren.
So just to move on real quick, and there's interesting, we'll get to the whole caregiver support and that type of thing from also a policy incentive-based perspective. So here's another program, this CMS Medicaid doled out $126 million to about 7 states, and to test an integrative care model, integrating a care team and program, social services, behavioral, physical. So we took the program in New Jersey, we created the branding, the engagement, our youth, our future. We kind of changed the voice of how it's communicated. And we deployed a street team made up of various folks that go in. And this is starting in 2 counties in New Jersey. And there's 40 other organizations. So by doing it the way we did it and allowing data and sharing amongst community organizations, providers, and plans, we got a lot of support in the community for the program. So we're getting data from all different types of sources, and we're giving back data to all different types of sources that's helpful. And what I want to do is you to hear, it's just a minute 55 from Venus. She's a psychiatrist, psychologist at Stanford's Clinical Excellence Research Center. And we're working on several programs with them that we have deployed in California right now. So she has been an expert in this area of community-based organizations and caregivers. So you'll hear a little from Venus.
What you may not know is the social care supply chain don't necessarily have a lot of visibility in the community-based organizations that offer these critical services for your patients and members. In the US, there are approximately 250,000 community-based organizations, and together they represent approximately $200 billion market. You should be worried about this because very soon, simply referring patients out is not going to be sustainable, it's not going to be sufficient. What you need is really deep visibility into the supply chain and to be able to find out the best fit partners who can actually serve your high-need, high-call patients, your vulnerable populations. And the phenomenon that we're seeing here today is not the first time that we see it in healthcare. Think about mental health and behavioral health. 10, 20 years ago, nobody wanted to really handle it. What plans or providers did usually was just like, okay, I would refer a patient or a member out. Then we started to see carve out, okay, let me carve out behavioral health, mental health. But today, as evidence and science, as well as financial data continue to come in, we know how important mental health and behavioral health is. And plans started to think about, I need to invest in digital mental health. I need to carve in mental health and behavioral health so that I can have more ownership and visibility and deep partnership with these providers. And we think that this is going to happen to social care as well. What you may not know.
So to play off of that, this is one of the programs we're doing with Stanford. It's deployed in Northern California. It's with a partner, SourceWise, who helps credential caregivers and deals with various community-based organizations in their area. And we created a digital engagement program that pulls together all of that into a single program. And the program actually very precisely gives caregivers the needed information based on the patient member's condition, CHF, diabetes, COPD, dementia, stroke, based on their medications, actually, based on their levels of memory loss or other issues. It guides the caregiver on how to be the best caregiver, and it also better and automatically connects them to various social services. You can see on the right, a few of them are listed. And lastly, I just want to say is it provides for the caregiver emotional support, learning how to also life balance of themselves, because you're going to see the impact on healthcare costs when a caregiver doesn't get stressed out. Very interesting. So, by the way, we're taking this program across the country shortly, nationally, to healthcare plans across the country to have a more precise way to integrate caregivers into the care coordination flow from a data perspective and a functional perspective. But Venus, this is only a minute 42. She has some interesting data for everyone in this regard.
Approximately 20% of Americans are family caregivers. Family caregivers offer so critical and foundational care for your members and your patients. But oftentimes when we think about our home health strategies or hospital at home strategies, we forget about them. We don't think about them. Let's use depression as an example. Some conservative estimation of the prevalence of depression in family caregivers shows that approximately 20% of family caregivers are depressed. If one of your member who has a depressed caregiver, you will see an increase of this patient's medical care by $1,300 in 6 months. And you will also see a 4% increase in the caregiver medical expenditure. Some of this intervention can reduce medical care cost by almost $2,000, $3,000 per year if you leverage this program to support family caregivers. So this is a very significant number. The opportunity here today is you have a chance to actually support one of the biggest problems in the United States, the family caregiving crisis, but in the meantime, also reduce the care costs for your member.
Okay, the last example, and then I'm going to put it together how we typically work with a plan to do this, bigger collaboration to help support various state initiatives, is I call it winning specialty populations. So we're just going to focus on an example in foster care and children with autism, but it could be a variety of specialty programs. We have programs for adult ID, DD in different states, prison and discharge prison populations, these specialty hard sort of to manage circumstances. So rather than me talk about it, Bhavini's with AmeriGroup, and this is the longest video, about 5 minutes, but she does a superlative job giving you a really ground floor perspective from someone who's been on the ground floor as a clinician, as a care manager, as a care coordinator, and now she is a director. So it really gives you a really good insight from someone who's has to face these problems at a Medicaid plan every day. So here she goes.
Well, hello, everybody. My name is Bhavini Solanki, and I serve as the director for the Georgia Family 360 program, which is a program within AmeriGroup Georgia's Medicaid managed care program. And the Georgia Family 360 program is a subset of that, about 31,000 members composed of kids that are currently in foster care, youth that have been adopted out of foster care, and a couple hundred justice involved members. So a lot of the focus of our work in just case management in Medicaid service is trying to get to members in a proactive way. Another challenge is just the growing need for behavioral health and autism-based services. I think what is important is knowing that telephonic case management really can only get you so far with a person. Finding a program like what we're going to be starting with GoMo Health has been really critical. It allows us to, have a digital solution, as well as have a solution that really expands our case management reach and allows us to triage situations going on at home so that our case managers know where to focus their efforts. I think the other great thing is this tool allows us to have some level of predictive analytics because we're doing a lot of proactive work and getting a hold of families, engaging them, making sure that they're educated on what autism is, on when the screening occurs, on what the results mean, so that we can line them up with services well in advance. Because we know, again, with all of the workforce shortages and just the high demand for autism-based services, and I think it's important to remember that kids in foster care and kids that have been dealing with child welfare, even if they're in a safe adoptive home, still have a high level of behavioral health issues going on and have a high level of perception or high level of entry, a path into juvenile justice. So the project that we are going to be starting with GoMo Health is very exciting. It's going to have 2 tracks. So the first track is to work with families who have youth that are already ASD diagnosed. That is in an effort to make sure that they're getting all of the services that they need. And really before that, to even understand what this diagnosis means for their child and their specific symptomology. And any issues that families might be having can then be routed directly back to their case managers. So those folks can update care plans and make sure we can get them to the right resources before anything gets worse or there's any kind of crisis that may come up. So that education piece there is going to be really important. The second track is where our preventative work really comes in. And this is where we're going to be making outreach through GoMo to families who've got children with EPSDT appointments coming up, where there's going to be an autism screening so that they, one, understand you've got an appointment coming up. Please make sure you attend it. Here's what to expect at the appointment. And once you get the screening results, here's what those results mean. And if there's follow-up that's needed, then we can help connect you with the right provider. We know what to expect. Like when a woman is pregnant, we know what's supposed to happen at 5 weeks, at 10 weeks, at 9 months. We have all of this information in these great books and tools that show us how big your baby's going to be at a certain age and all that good stuff. When your child is born, there's the same tools that are available. But if you have a child that doesn't go down that path and they are off on their developmental milestones, it can be pretty jarring for a parent. But what's beautiful about this program is it gives these families the support that they really need at the time that they need it. Working with families with these children, you can see that they are under high stress, whether they have one children or multiple children. It's a high stress environment. You're living with a child who just doesn't have the same engagement with the world as you do. And so your expectations are completely different. And it's hard to connect with them, even from a parent to child aspect. And for someone trying to bond with their child, that can be a really challenging place to be. So having information, having GoMo, and having all the tips and tools that they will provide at the very moment that you need it is the exact support network that families may not be able to get to. And although I think our world has evolved and we've got support groups and even online support groups, and those are great. But in the moment that you may need some very specific information, it's not always helpful to try and find somebody that may have had that experience versus having these tools from experts that can really get you to the solution that is going to be most helpful for you and for your child.
So I'm not going to go into details here, but there's some fascinating stuff going on in the world of maternal child health and anxiety, stress, depression that really is helping with a lot of things, including reducing preterm birth and postpartum and mother-child. But for purposes of today, I'm going to just now skip to show you this is the last few slides and how we put it all together for a plan. So we have a performance and quality managed service and engagement hub. And basically, whether a plan starts using us for one thing or multiple things, over time, we have plans that are using us for over 30 different programs. But it works all the same way. It learns about the members, it handles comorbidities, it interacts with other social services and community-based organizations, it's interoperating data. And we even engage other engagement vendors so we could pass information. Let's say you have a nutrition company and behavioral coaching, and we can collect information, pass it to them, understand when someone could use that service. So we could even help increase utilization of your current apps, programs, and those things that you have deployed. And we're typically interfacing to these types of backend. We have hundreds of interfaces with our various plans, and then we're producing some very interesting correlated data analytics. So here's basically how it works to summarize. Let's say we're just starting. This is just an example with case care management. They're interested in these outcomes. Let's say the plan tells us cost containment, quality measures, staff productivity. Okay, just as a use case. And then who do they want to reach with this program? So in this use case, they want to reach members, caregivers, and social service organizations. They pick from what programs we have or what they want us to build. So in this example, they're picking behavioral health, maternal child health, and prevention and well-being. And then they're picking, hey, we'll manage medications within the areas we pick. They want us to do COVID short and long haul. We have our whole instant messaging system, which tens of thousands of care coordinators use for alerts, escalations. an automated transfer in and out of the organization to social services, to community organizations within your plan. And then they want us to also create a better closed loop activation system with social services. So that's, let's say, a starting point. So this is a summary of that. So we configure our managed service to handle this. And that's really how we work with a plan to simplify it. So my last slide is the takeaways, is really there's some interesting new behavioral economics going on, as we all know, with value and outcome-based incentive performance. You can win in this environment with this type of approach. It can really be highly scalable to produce outcomes and reduce gaps. There's an opportunity for your plan to be that connective tissue within a state, within a region, within the nation, to be able to do this and integrate social, behavioral justice care into a program. So bottom line is that the message and the final takeaway is we believe and we know from working with over 15 plans, it can really help on the top line and gross margin revenue, getting more out of your staff, and at the same time, really help your staff with joy in practice, retention, productivity. So that's the talk for today, and thank you for listening. If anyone wants a copy of the presentation, you can email me. I'll leave this on the screen for a second. You certainly could get my information from Patrick and MHPA. And now I'll open it up to questions.
Okay. Thank you, Bob. Do you want to do the poll?
Oh, yes, Patrick. I forgot
All right.
about the poll. Can we please do the poll?
Okay, here we go.
So everyone, take a minute. If you could read these, just of the ones that you think your plan would be more interested, or your job, or whoever you're representing, if you can check any of these, or whichever ones you feel you're more interested or are interested in. We're just curious to get a feeling from the audience, which of these are more enticing to you in the population. So we'll give you a minute, and then Patrick will put that up on the screen. Sorry, Patrick, I meant to do this earlier.
All good. All good. I
Um,
think it works well at the end. And folks, you will get to see the results. So everyone, please participate if you can, because I think it would be helpful for everyone to see the results. So we'll give it a few more seconds here. Appreciate everybody who is participating. Helps enrich the webinar. Okay, last chance. Last
All
chance.
right, going.
Going. People are still getting in under the wire. I feel bad. I want to. Okay, here we go. End poll. Okay.
Very interesting. All right, well, I think that's some interesting data, and we'll share this as well.
Yeah.
Right. Thank you, Patrick, for doing that. That's very interesting.
My pleasure.
All right. If there's any questions, let Patrick know on the Q&A.
Yeah.
And
Fantastic. Yeah, there's still time before we get to the questions. We have 3 right now, Bob. But folks, you still have time if you have a question, right? Or you can contact Bob and the GoMo team directly. But we do have time if you're interested. Now, with that said, let's get started. First question: how can we get more information on one of the plans that was highlighted?
so if you contact me, I could have the right person on our team walk you through. We could tell you what plans that we're working with and those things. Obviously, there's only a certain amount we can disclose, but we could certainly talk to you and get you more details on some of the stuff we're doing. And then we could also send you a copy of the presentation. So if you contact us via email, we're happy to do that.
Okay. Next question: how big is your organization? Sounds like you guys do a lot. I'm
So,
sorry. Okay, go ahead.
yeah, so I'm not so sure how they're asking the question, but we do interact with millions of lives a month. We do support, in addition to over 15 health plans, dozens of providers. And interestingly, just to make a comment on that, we do a bunch of integrative provider plan programs like with United Healthcare and others. And now we've suggested to a few of our plans, which we may do, one of the first ever integrative employer plan provider closed loop programs. So, yeah, and we, FYI, just example, for us, a very large health plan, we actually run their internal health and wellness program for their 50,000 employees, both in the US, India, Philippines, and other countries. So, yeah, so we have the ability to scale.
Perfect. Next question. Assuming you are primarily working with Medicaid at this time, are you also working with self-insured employers and health benefits? I think you might have just answered that.
So the answer is today's presentation is for the Medicaid Health Plan Association. Now, many of our clients are Medicaid, Medicare commercial. So yes, we do dual programs, Medicaid, Medicare. We do Medicare Advantage programs. We have probably the most sophisticated integrative medical oral care program for pregnancy, cardiovascular diabetes, in commercial Medicaid, Medicare. And yes, and we are also actually work directly with a bunch of employers as well. So many of our plans use us across divisions, Medicaid, Medicare, commercial, but I didn't highlight that today.
Awesome. Okay. Let's see here. Some more. Okay. Bear with me, guys. We have two more we want to get to. You still have time. Last chance. Specifically, how does GoMo work with an MCO to close gaps in care?
Yeah, so typically there's two ways of working with GoMo. If the MCO believes it knows exactly what gaps it wants to focus on and it has them down, we can start with those. And we have a whole managed service team that works with the plan and to do that. And we create the engagement program and protocols and dashboards. So we can have that up and running very shortly, and it all conforms to the objectives and measurements of what the plan wants to hit in terms of how we do that. Now, as part of that, we could also work with the provider network. We can help you score. We can help you understand why certain providers aren't closing gaps and those things. And then at a third level, at a higher managed service, we could also suck in various data. And if you're interested in our point of view from doing this in many places where we think we have the most chance of closing gaps and what we could work on, we could also analyze the data and help you with that as a partner. So you can use us very tactically to start. You can use us strategically or some combination. You don't have to start with everything. We could start small and you can grow it. You know, you can integrate that into kind of the social fabric of what you do.
Perfect. Okay, looks like we got another question. Are you incorporating obesity programs?
So, because in many of our programs, we connect like the mind and body. So it's like whole care, psychosocial, and all those lifestyle support. So in most of our programs, regardless of the physical or behavioral condition, we're addressing things like movement, exercise. We have various ways of integrating nutrition. In fact, we have a validated from probably the top guy at Yale in the United States in nutrition, a way to scoring someone's eating habits and adjusting recommendations based on that. It's fascinating by just looking at pictures. And we could also integrate and refer to other nutrition RDs and other people who can help. We can discover who needs it, right, the most. So for example, like in our oncology programs, a lot of the oral oncolytics, infusion programs, chemo, radiation, immunotherapies wreak havoc on your oral cavity. You may need also on your vitamins and minerals. We have integrated programs like in oncology that can help you understand what to eat and what could be most helpful, or we could refer you if you have a third party in your organization that handles that, but we could discover when someone needs it. So yes, and particularly with obesity in Medicaid, by the way, we have a really slick program for adolescent obesity as well. Kind of a fitness program for teenagers and adolescents who are obese.
Okay. All right, last question. What is the strategy and approach to get cooperation from social services and community-based organizations?
Yeah, so I would say the strategy approach is similar to how you develop a friendship with a person. There has to be reciprocity, right? So when we created those programs, and we got 30 organizations to participate, willing to share data, because we're giving them something back. We're giving them interesting findings. We're giving them also some data back, but in a very secure way that's high trust and HIPAA and all that. But it's helping those partners. If you're a plan, how is your message to a social service or community-based organization going to say, hey, community-based organization, we can help you scale. We can help you service more people, right? We can help your business model. It's not just about, hey, can you help our business model? So we have a very succinct way of engaging partners on behalf of health plans that renders 5x the amount of cooperation. And we've just been at it a long time, so we made every mistake also, so we know we have a good science around that now.
Awesome. Okay, great. Well, I think that wraps things up. Again, if anyone wants to slides, reach out to Bob or me, and I'll make sure I'll send you over to the GoMo team to make sure you get those along with any questions. I know they're happy to respond and help out. I want to thank you, Bob, for this great presentation. I really enjoyed seeing all the other folks on the screen talking. That added a lot, and you have a lot of great expertise. And as a reminder, you can find the GoMo team at MHPA 22 in Phoenix this September, our annual conference. Please register and attend. And with that, again, thank you, Bob, and thank you everyone else for attending today. Have a great afternoon.
You're welcome. Have a nice day.